Hello and welcome to the Oakland County Megacast. I'm Tyler Keefe alongside Ronnie Dahl in the studios of Civic Center TV and 89.3 Lakes FM. In addition, today we are on Birmingham Area Municipal Access in Birmingham, Bingham Farms, Beverly Hills, and the village of Franklin as well. Also today on 88.1 WBFH, The Biff, as well as on our Facebook pages, Civic Center TV 15 and Lakes FM, facebook.com/Civic Center TV 15 and facebook.com/Lakes FM. We're going to go straight to Lansing, where Governor Gretchen Whitmer will be addressing the press today regarding the latest in the COVID-19 situation in the state of Michigan. Governor Whitmer has taken the podium and will begin shortly. Here's the video of that, and here is Governor Whitmer.
Medical executive, and Tina Freese Decker, the president and CEO of Spectrum Health in Grand Rapids. So, good morning. Today we're going to discuss Michigan's ongoing vaccination efforts and address the recent rise in cases. Michigan has administered over 5.1 million doses of the safe, effective COVID-19 vaccines to over 3.1 million Michiganders. That's 5 million doses in less than 4 months to nearly 40% of our state. And we're speeding up. We went from 4 to 5 million doses in under 2 weeks. On Tuesday, my older daughter and I were proud to add 2 to that number when we got vaccinated at Ford Field by Michigan's Chief Medical Executive, Dr. Joneigh Khaldun. I also want to acknowledge some members of the legislature who've gotten vaccinated recently, like Representative Graham Filler, Representative Christine Morse, Senator Eric Nesbitt, and Representative Felicia Braybeck, for leading by example and getting their first shots recently as well. Those are legislators from both sides of the aisle, and I think that's important for us to know. We're all in this together. Almost 175 million doses of the safe, effective COVID vaccines have been administered across America, which is smashing President Biden's goal of 100 million shots in 100 days. Over 1 in 3 Americans have received their first shots, including 77% of seniors and over 80% of teachers nationally. All Michiganders 16 and up are now eligible to get vaccinated. The vaccine is the most effective way to protect you and your family from this virus. And getting vaccinated is the quickest way for our lives to return to normal. I urge you to get your shot at a local pharmacy, a drive-through location, a mobile clinic, or at one of our community sites like Ford Field or the one at DeVos Place in Grand Rapids. There is light at the end of this tunnel, but the recent rise in cases is a reminder that we are still in the tunnel. The only way out is forward and together. We have all the tools we need. We know what works. We must mask up, socially distance, wash our hands, stay home when we're sick, and most importantly, get vaccinated as soon as possible. Our effective vaccine response is a testament to what we can do if we work together. Getting vaccinated and staying out of the hospital is a good way to thank our healthcare workers, our medical professionals, and hospital staff for their incredible sacrifices and service over the past year. We should also recognize the frontline workers who have all gone above and beyond to keep the rest of us going, and the scientists and researchers who designed, tested, and manufactured these 3 vaccines, miracles of modern science. I know Michiganders have made extraordinary sacrifices over the past year, and I want to get back to normal as much as everyone else. I'm tired of this, but we've got more work to do. We could get through this quicker and stronger if we got a little more help, too. We've administered first doses to 3 million Michiganders and repeatedly hit our new target of 100,000 shots a day, which is great progress. But the variants in Michigan that we are facing right now won't be contained if we don't ramp up vaccinations as soon as possible. We need additional supply of the one-shot J&J vaccine, which we believe is vital to our strategy of rapidly distributing vaccines and slowing the rise of spread. From public health research, we know that the one-shot vaccine is critical to protect younger Michiganders, or those who may have difficulty getting back for a second shot. We've been speaking with the administration in Washington, D.C. regularly over the last few days, and will continue to do so. Because anyone who looks at a COVID map knows Michigan is unquestionably a national hotspot right now. My team and I have been in regular conversation with the National COVID Response Team, and we have asked for more vaccines. I'm grateful for what they have offered: therapeutics, additional personnel, mobile testing, and vaccination units. But I am concerned because I believe, as do a number of public health experts, that we really should be surging vaccines to states that are experiencing serious outbreaks. A bipartisan letter from Congresswoman Dingell and Congressman Upton also echoed our call for more tests, more supplies, and more boots on the ground to slow the spread and save lives. So look, we've been doing this for a year. We have all learned to surge PPE, tests, and vaccines where there is greatest need. And just as we, the state of Michigan, stepped up to prioritize areas of our state, or even assist other states in need when there was a crisis, whether it was a need for PPE or ventilators or firefighters or National Guard or masks, we stepped up and helped our fellow states. So I'm urging the federal government to create a vaccination surge program to help states like Michigan now. Because it's Michigan and the Midwest today, and tomorrow or next week it could be the Northeast or the South or another part of our country. President Biden is someone for whom I have a great deal of respect and personal affinity. He's my friend, and he is doing an amazing job responding to this pandemic. A year ago, I took a lot of heat for speaking bluntly about the lack of a national strategy. The Biden administration does have a strategy, and by and large, it is working. As should be expected, though, in an undertaking of this magnitude, there are shortcomings and different points of view. I appreciate President Biden's confident, competent leadership, and we are grateful to the administration for rapidly increasing vaccination supply nationwide. But we are still in this pandemic and continue to have conversations with public health experts. Recently, I spoke to Drs. Ashish Jha, Dr. Scott Gottlieb, Dr. Zeke Emanuel, and Dr. Josh Sharfstein. We talk every couple of months to check in. And these talks are a part of our regular conversations so that we can have all the information as we make decisions here in Michigan. These experts noted that our recent rise in cases is a compliance, variance, and mobility issue. We know enough about COVID-19 after a year of living with it that we know what works and what we have to do to reduce cases. We know that policy changes alone won't reduce the spread. So right now I want to speak to every Michigander directly. I want to emphasize we still have public health rules in place to save lives. Although we've announced some re-engagements over the last few months, we still have a mask mandate. There are still limits on indoor social gatherings larger than 25 people. We have mandatory testing requirements for sports. We're making testing easier for spring break travelers with 56 pop-up sites statewide as a part of a special testing program. We're also hosting a webinar tomorrow for folks who want to host a pop-up clinic. But as we take a hard look at the data and observe the spread of the variants, we all need to go above and beyond the rules we already have in place. We all have to step up our game for the next 2 weeks to bring down rising cases. And that's why I'm calling on high schools to voluntarily go remote for 2 weeks past spring break. Calling on youth sports to voluntarily suspend games and practices for 2 weeks. And I'm strongly encouraging all Michiganders to avoid dining indoors and avoid gathering with friends indoors for 2 weeks. Support your local restaurants by eating outside or getting carry-out instead of dining indoors. Opt for small outdoor gatherings with masks. To be very clear, these are not orders, mandates, or requirements. A year in, we all know what works, and this has to be a team effort. We have to do this together. Lives depend on it. We have to fight back against COVID-19 variants. We have to get vaccinated to keep you and your family safe. We're going to have some tough weeks ahead, so I'm asking everyone, please, take this seriously. This is my ask to you, the people of Michigan. Please redouble your efforts on these fronts for the next couple weeks. I know Michiganders are concerned about the latest rise in cases, and I am too. We've come so far. We've sacrificed so much. This has changed every aspect of our lives for over a year. We can't let up now, not when we're so close. However you want to think about it. Bases loaded, bottom of the ninth. Second overtime, shot clock running out. Fourth down on this 2-yard line with 5 seconds left in the fourth quarter. We cannot afford to strike out, miss the shot, or fumble the ball now. It's everybody against COVID, and we have to keep going until we win. That's the nature of this virus. The second we let our guard down, it comes roaring back. Luckily, we can put it behind us once and for all if we get vaccinated, but we can't get complacent in the meantime. The best way to bring cases down is for every one of us to do our part. So even if you've been vaccinated, keep masking up. The numbers show young people are not impervious to this virus, as we've seen a lot of cases among teens and young adult Michiganders. To bring cases down, every Michigander has a personal responsibility to mask up, wash their hands, and socially distance to slow the spread. We got to get enough folks vaccinated to put this behind us. I know it's been a long, difficult year, but let's just take a moment to appreciate how close we are. Think back to last spring when our primary concern was just getting our hands on PPE. Think about last fall when we had no idea how far away vaccines were, and medical experts said we would be lucky to get one in the next few years. That was 50 to 60% effective. Think of the optimism we feel today. The number of safe and effective vaccines. 3.1 million Michiganders have been vaccinated and over 100,000 doses administered every day. I urge all eligible Michiganders to get vaccinated as soon as possible because it's the most effective way to protect you and your family and get back to normal. So to find a vaccination provider in your area and to schedule your appointment online, please go to michigan.gov/COVID vaccine to sign up as soon as possible. From personal experience, I can tell you that it feels great to have gotten my first shot, and I'm eager to get the benefits of the second one in 3 weeks. The 15-minute post-vaccine waiting area is one of the most optimistic places in the country right now. People are making plans to see friends and family with big smiles under their masks. You can see it in their eyes. Their sighs of relief, tears of relief, sounds of gratitude. People making happy calls and sending joyful texts and posts. On Tuesday, I was happy to join those celebrations. I can't wait to be with my friends and family this year, and I know we can beat this together. An incredible summer, our Independence Day, normal life. These are all within reach. The path is clear. But we got to double down on our efforts now to slow the spread and get vaccinated. We have to hang on a bit longer. I know we can. So let's get it done, Michigan. Thank you, and with that, I'll turn it over to Dr. J.
Thank you, Governor. So as the governor mentioned, I am quite concerned with what we are seeing in our data. We are on track to potentially see a surge in cases that's even greater than the one we saw in the fall. We are now at 515 cases per million people. That's 4 times where we were in the middle of February. The percent of tests that are positive has now increased to 18%. Also 4 times where we were in the middle of February. We have not seen that high of a positivity rate since our first surge last spring, a year ago. And that's concerning because we are doing many more tests than we were then. And this indicates that there is now broad community spread. Hospitalizations are also increasing. 15.2% of hospital beds across the state are now being used to take care of patients who have COVID-19. And we now know that hospitals are evaluating and implementing their surge plans, including consideration of canceling elective surgeries that are not time sensitive and preparing to make sure they have the equipment, supplies, and staff to be able to take care of both COVID and non-COVID patients. MDHHS is also tracking 991 outbreaks in counties all across the state. That includes new outbreaks in K-12 schools, manufacturing and construction, long-term care, child care, retail, restaurants, and bars. Between January and March, we saw 291 outbreaks associated with youth sports teams, both contact and non-contact sports, that involved at least 1,091 people. We have seen 58 new outbreaks in just restaurant and retail settings alone in the past week compared to the previous week. We also know there's general community spread of the virus. This includes the spread of these more easily transmitted variants. Our lab has identified 2,262 of these variant cases in 60 counties across the state, and there are likely many more that we don't even know about. And because we are seeing so many cases a day, our public health system is overwhelmed. We are not able to get information on many cases, nor are we able to identify their close contacts. We don't know where all the cases or outbreaks are, and what we do know is likely an undercount. So these trends are concerning. We need everyone to do their part, not only to protect themselves. Think about the person who may have an underlying medical condition or who is older and is more likely to die from COVID-19. Think about the person who may need to have a surgery or seek emergency care, and the staff or beds may not be available in the hospital. This is serious. We are all connected and we're in this together. And now is the time for us all to heed these warnings and do our part. So the data is concerning, but there is no need to panic. We know how to do this. And I want to be clear, and I've said this before, just because something is open, it does not mean that it is safe or that you should do it. Given where we are with our numbers, MDHHS recommends that all high schools pause in-person learning for 2 weeks. Students and staff should also get tested if they have traveled during that time. As the governor mentioned, we have over 56 pop-up testing sites with schools on campuses across the state that are offering post-spring break testing. We also recommend that all youth sports, both contact and non-contact, pause both practice and competitions for 2 weeks. Everyone should also be implementing specific public health mitigation measures in their personal lives. Infectious disease and public health experts across the country have been quite clear that indoor dining is one of the riskiest things you can do during this pandemic. And with the numbers that we are seeing now, we simply do not recommend it. You should order takeout or drive-through service or do outdoor dining. My family orders takeout multiple times a week. You should avoid gatherings with multiple households. And if you do have a gathering, it should be small, it should be outside, and people should be wearing a mask. And you should get tested. If you've been exposed, especially if you just returned from a spring break trip, get tested. We've worked with local partners to set up testing sites at some state welcome centers and airports even to make sure it's easy for you to check, get tested, and make sure you don't bring COVID home. You can also and should download the My COVID Alert app so that you are alerted if you come in close contact with someone who has COVID-19. It's free and it's confidential, and it's even more important now because our public health system is overwhelmed and cannot keep up the pace with all of our new cases that are coming in every day. So these are very tough things to do, and we do not make these recommendations lightly. But everyone needs to understand that if we can just pause some of these activities temporarily, it will go a long way to prevent the spread of the virus and to save lives. These measures work. We also know that vaccines, of course, are the most important tool we have to prevent the spread of COVID. Everyone in the state over the age of 16 is now eligible to receive one of these safe and effective vaccines. And I want to be clear, these vaccines have been studied in tens of thousands of people. We now have data from almost 175 million doses that have been put into the arms of Americans over the past 4 months. The science is very clear. These vaccines work, they are effective, and known potential side effects like a sore arm or maybe a mild fever or body aches, that's to be expected, and it means that the vaccine is working. We have the capacity in the state to do over 100,000 shots per day. And I'm thrilled that we now, today, will reach an incredible milestone of 5 million doses in arms. Vaccines are simply the best tools that we have to slow infections and be able to return to a greater sense of normalcy. There are also things that you can do after you've been fully vaccinated, meaning 2 weeks after your final dose of your vaccine. You don't have to quarantine if you've been fully vaccinated and don't have any symptoms. You can travel around the country without getting a test. And you can have gatherings with other fully vaccinated people outside of your household without a mask. So vaccines not only drive down our cases, but they change the things that you are able to do in your everyday life. So if you haven't scheduled your appointment yet, please visit our website at michigan.gov/COVID vaccine for a link to your local health department and suggestions about other places where vaccines are available. And if you don't have reliable internet or you need help, you can still call 211 to be connected to the state's COVID-19 hotline. But until then, we all have the power to protect ourselves and our loved ones by wearing a mask over your nose and your mouth whenever you'll be around someone outside of your household. Keep your distance, avoid gatherings, and get tested. We are all tired of this virus and changing the way we have to do things every day, but please do not give up. We are just so close. So thank you, and with that, I will turn it over to Tina Freese Decker, CEO of Spectrum Health.
Thank you, Dr. J and Governor Whitmer. In healthcare, we like to focus on hope and healing. And we have so much hope right now because we know that a better normal is ahead for all of us. Today, we're celebrating a new milestone of 5 million vaccines across Michigan. This is clearly a sign of hope for our future. In West Michigan, like other parts of our state, we have a collaborative that is working so hard to get vaccine to people as quickly and conveniently as possible. We recently celebrated a day where we gave more than 12,500 doses in one 12-hour clinic. I am incredibly proud of our team at Spectrum Health, as well as the teams at all the hospitals, physician practices, health departments, and pharmacies across our state who are involved in caring for our communities and distributing the vaccine. I'm grateful for the physicians and the nurses and other team members that day after day are caring for people with COVID-19 after this very long year. And I'm also incredibly proud of our communities. You have stood with us, walked alongside us, and you have heeded our messages to make sure we're practicing those safety precautions for COVID-19. And so now we need your help again. At present, we're seeing a concerning increase in COVID-19 positivity and the hospitalizations. This virus, like was said earlier, is widespread in our communities. At Spectrum Health, the number of cases, the number of patients within our hospitals has doubled over the last 2 weeks, and it continues to climb each day. For Spectrum Health, our positivity rate is now over 16%, very consistent with the rest of the state. And the new B.1.1.7 variant is likely contributing to this surge, which wasn't present last fall. B.1.1.7 is now the dominant strain nationwide, and Michigan has the most recorded cases. It is at least 50 to 75% more contagious than previous circulating strains, and it has the propensity to spread faster and cause larger outbreaks, particularly among unvaccinated persons when mask wearing and social distancing isn't followed. It also has a higher propensity to be spread by children, in contrast to previous circulating strains. Fortunately, all 3 available and authorized vaccines provide excellent protection against infection by B.1.1.7, which reinforces why getting your vaccine is so essential. So we need to treat this surge, seriously. I have 2 important messages for you today, and they were reinforced by our nurses and physicians who I talked to this week. The first is prevention. We cannot give up this fight. Prevention is critical to reduce this spread and to protect our community. I realize that we're all very tired of this, but it is just critical that we follow the best practices. Wear a mask, wash your hands often, and keep your distance. And then the second important message is get your vaccine. It is our hope for a brighter future. Getting vaccinated is another important step to take care of yourself, your family, and our community. In the latest surge, we are seeing the benefits of the vaccine. In fact, the people showing up in our hospitals are much younger than in the fall surge, and that shows that the vaccine is working. As was said earlier, there are multiple ways to get that vaccine, and our hospitals, health departments, community partners, and pharmacies are all ready to make sure that you can get that vaccine. So we need to keep prevention top of mind until everyone has an opportunity to access this vaccine. I realize this is hard. It takes endurance, it takes patience and vigilance to reach that 70+% herd immunity. But as I rounded with our nurses and physicians this morning, the two things they said today was wear a mask and get vaccinated. So on behalf of them who've worked so hard this year, please take that advice. Wear your mask, wash your hands, avoid large gatherings, and get your vaccine. I'm hopeful that this will be our last surge, so please join with us to practice these preventions to make sure that it is our last surge and we have a healthy Michigan. Thank you. Governor Whitmer.
Thank you, Sita. That was great. Great. So I'm here with Dr. J and Tina. We are happy to take some questions. And as promised, I think I will start with Emily Lawler.
Governor, sorry about that mute button. Just wondering why recommend the pause instead of require it for high schools and youth sports?
Well, let me start with this. You know, this pandemic has been hard on every single one of us. We're all tired of this. And the actions that we've taken throughout the course of the pandemic have saved lives, and especially in the face of a novel virus, which we didn't know much about a year ago, especially in the face of a second surge where we didn't even have vaccines on the horizon. We know now that we've got the tools we need to protect ourselves, and it is less of a policy problem that we have and more of a compliance and variance issue that we are confronting as a state. Policy change alone won't change the tide. We need everyone to step up and to take personal responsibility here. So I'm not taking any options off the table, but in this moment, we are strongly urging that public schools and youth sports voluntarily take action. We are strongly urging restaurants and diners to be smart and eat outdoors or get takeout. We know what works, as Ms. Freese Decker just said. We know what works, and we all need to double down our efforts toward making sure we push down the spread of this virus. These variants are incredibly serious and easy to catch. Because we kept our positivity rates low for a long period of time, now that the variants are here and people are fatigued, we're more vulnerable because we've got large reservoirs of people in our state who have not caught the virus yet. And that's precisely part of the issue that we're confronting, and that's why it's not about a policy change, it is about behavior change, and we need everyone to be a part of that.
Governor Dave Boucher with the Detroit Free Press next.
Hi, Governor. Thank you for taking the time. Two really quick questions. One, if this is a compliance problem, why do you think anybody will comply with your recommendations now? And two, in the fall, you said your relationship with then candidate Joe Biden would help the state in its fight against COVID-19, and yet now it sounds like the Biden administration isn't surging J&J vaccines to states like Michigan. Why do you think that is?
So first, you know, I think people are tired. They think that because vaccines are here that we can start to drop our guard. I know that people are traveling. Snowbirds are coming back to Michigan. People have been traveling for spring break. All of these things are contributing to the spread of these variants. And these variants are just much more contagious. As I said, we've got reservoirs of people who've not caught COVID because we've had smart policies on the books. At this point, we think it's important that people understand how very serious this moment is, and that's why Dr. J went through the numbers. That's why Tina Freese Decker went through what's happening and they're seeing in our hospitals. That's why it's incumbent on us to remind people no one is free from getting this virus unless you've gotten that vaccine. So get the vaccine. And if you haven't yet, make your appointment. And for everyone, until we get to over 70% of our population vaccinated, we got to continue to mask up and wash our hands. I am grateful for a lot of the work that the Biden administration has done. As I said, since taking office, we have seen incredible improvement in terms of vaccines and having the ability to know what is on the horizon and coming. We're continuing our conversations. They're sending a number of things to support us, whether it's the therapeutics or it is mobile testing and vaccination ability or boots on the ground. But we are going to continue to fight for additional vaccines. That is not a policy that they have embraced at this juncture, but I'm going to continue to fight for our state. I'm always going to do that. I believe that a surge strategy is prudent, equitable, and important, and that's the case that I'm making to the head of the COVID response team in the administration.
Our next question will come from Jonathan Khaldun with HuffPo.
Hi, thanks for taking this call. One question I have, this goes a bit of a follow-up. The request to the Biden administration is to surge vaccines from to hotspots, basically, which would mean taking it from places that don't have hotspots. And I'm wondering, are you doing anything inside the state of Michigan to surge vaccines to hotspots, since there are some parts of the state that have much heavier caseloads than others? And if not, why not?
Yeah, we have done some of that. The problem is when you look at the map, the whole state is a hot spot. And that's precisely why we're making the case that we should have a surge strategy as a nation. I think that that's really important. So we are allocating based on need within the parameters of the vaccines that we have. We're moving quickly. 5 million shots in arms. We're one of the states that's been able to move the fastest. We've met all of our benchmarks, and it's an incredible network of providers that we're working with. And I mean, one of the things that I think has been so impressive, whether you go to Ford Field or you go to DeVos Place or you're at a local public health vaccine center, the work is happening and we are making great progress. We just need more vaccines because we are a state that has a lot of variants, and we've got a big part of our population that never got COVID in the first place because of the protocols that we've had in place, and that's precisely why this is a unique moment. We need some additional assistance here, and that's the case that we're going to continue to make, and as we are working tirelessly to get everyone vaccinated and encouraging people to make their appointments to get vaccinated.
We'll turn it over to Zeke Miller with the APX.
Thank you, Governor, and thank you for taking the question. We understand that you spoke last night with President Biden. Did you convey the request for the surge directly to him? And what was, can you characterize the nature of his response to you and his involvement in the planning of your state's response to this latest surge? And then secondly, can you confirm whether Michigan has in fact ordered 100% of all the doses allocated to it by the federal government, or has it been a lower than 100% metric?
So yes, I did speak with the president last night, and we have spoken with a lot of people on the COVID response team and various agencies of the administration. As always, it was a good conversation, and they've offered up a number of ways to assist our efforts, and we are very appreciative of that. Let me start with that. I made the case for a surge strategy. At this point, that's not being deployed, but I am not giving up. I think it's really important that we continue to do so because, as I said in my comments, Today it's Michigan and the Midwest. Tomorrow it could be another section of our country. And I really believe that the most important thing we can do is put our efforts into squelching where the hot spots are. I think it's about equity, it's about strategy, and I think it's the right thing to do. I've talked to a number of my colleagues, a lot of my fellow governors. They're very worried about what they're seeing in their numbers. Michigan often has been on the front end of these surges, and that could be the case here, and that's why it's so important that we surge vaccines into hot spots, and I'll continue fighting for that.
We'll turn over to Rachel Just with WDIV.
Hello. Hi, this is Mike.
Hi, Rachel. Can you go ahead?
I'm having a hard time hearing you. And you know what? I didn't answer the second part of that last question. I'm going to ask Dr. J, too, about our ordering of vaccines. So, Dr. J.
Yeah, so the state of Michigan, we do allocate and order down all of the vaccines that are accessible to us. We actually met with the White House team yesterday and walked through our entire ordering strategy and when we ordered what and when. So it is very clear, and they agreed with us, that we are ordering all of the vaccines that are available to us.
Okay, let's see if we can get you now.
Rachel, for the next question.
Thank you for taking my question, Governor. Hope you're doing well today. I wanted to ask, I know that Let Them Play Michigan has been pushing to get rid of testing and quarantining for students. Do you think now is the time to have that happen? Do you think now is it time to trust them with that? Or another question I have for you as well is, can you confirm and can you respond to reports we're seeing that ICE sent hundreds of migrant children to be housed at a youth home in Albion?
I'll follow up with you on the second part of that question. We'll have to do that after the press conference. I'll have my team follow up with you on that. You know, with regard to kids' sports, we know that this is a significant factor of spread that we are seeing. We know that, and it's an ongoing concern of ours. I know that there is a very vocal group that is fighting to ensure that kids can play. I get that. I support it in concept, but the fact of this virus is that is where we're seeing a lot of spread. And if you look at the national map, you know, Michigan currently is a place where we've got COVID that is a real concern in all across our state, in every community. So I do not think changing or loosening things around protocols that we have put in place to keep kids safe is a good idea at this juncture. I don't know if Dr. J, you've got anything you want to add? Okay.
Thank you, Governor. The next question will come from Mitch Smith.
Hey, Governor, thanks for taking my question. Two parts for you. One, Michigan's roughly in the middle of the pack nationally right now in administering the doses it receives from the federal government. I'm curious how a surge strategy would fit into that, whether there's a plan to speed up the administration of the doses that have been delivered. The second is there a threshold for case numbers or hospitalization numbers or any other kind of metric at which you would go to mandates for the steps you're recommending today or other tighter restrictions as opposed to suggestions for people?
So I'm going to ask Dr. J to answer the first part of your question.
So absolutely, again, also on our call with the White House team yesterday, we went through all of our allocations. We went through how much we might have in inventory. The majority of those doses are actually scheduled or they're already in arms. So if you look at our allocation, if you look on a Tuesday or Wednesday, for example, that's the day when a lot of providers actually receive their vaccine. So yes, it is going to look like it's in inventory, but we are doing quite well with getting those shots in arms, as we've asked all of our providers, within 7 days. The expectation is not that at any given time someone would have zero inventory, because it's just much more complex than that, but we are absolutely quickly. We're surging vaccines to places like the Voss Center where they can get up to 30,000 doses in arms. So we're making sure that we're giving vaccines to those who can move quickly. We also have to be mindful that we have to address those high SVI areas where you may work with a neighborhood center or a church, for example, or perhaps you can't do as many vaccines, but we are absolutely getting shots in arms as quickly as we can. We're meeting with our hospital providers and our local health departments and certainly emphasizing speed, and we are doing quite well in the state.
And then back to the last part of your question about, are there things that we're seeing that might inform a decision to make additional changes in our protocols? I know I've said this many times over the last year, but we're going to obviously work with our health systems like Spectrum to make sure that we know what's happening with regard to hospitalizations. We know that right now we are seeing hospitalizations up. It's a younger group of people. The mortality rates are lower. I'm certainly not minimizing the seriousness of this, but I think that that's part of the contextual piece that goes into where we're at and what the protocols are and why we have to put the foot on the gas to get the state vaccinated and implore people in the interim to do their part by masking up. So as always, those are the metrics: the positivity rate, the hospitalizations, mortality rates, and context. And vaccine dissemination is a big part of that context. We're at 5 million shots now, which is incredible. We are moving swiftly. We are actually, depending on which metric you look like, and that's why we don't look at the national rankings because they change every day practically, but we are in the top states in terms of getting vaccinations in arms, especially for bigger states like Michigan. So we got to keep doing that.
The last question will come from Eric Lloyd on 9 and 10.
Good morning, Governor. Since it seems like policy is not going to get us out of this, you say vaccines are. At our current pace, what is the timeline where we're going to start seeing the vaccines take a chunk out of these rising cases and getting closer to that 70% mark the state wants to hit?
So I think at an upcoming press avail, we will bring in a lot of the people that have really been helping us with our logistics and numbers. And we're really grateful for the help from Dow in particular, who has been a partner in this. We would anticipate that if vaccines come as we currently expect them to, meaning there's no glitches, and just this week we saw there was a glitch with J&J, and it's we're getting fewer J&J than we expected. There was a snowstorm a few weeks ago that was a setback. So assuming there are no setbacks and everything goes as we are led to believe that it will go, and we don't have any lulls in terms of demand, which is another big if, we could theoretically, by the middle of May, be to a place where we're at 70%. Now, how likely is that? Probably not highly likely, because there are high probabilities something will be a glitch, or we will have to do more work to earn the confidence of the public to get more people to be interested in getting vaccinated. But at this juncture, if all of those things happened well in advance of, or at least by the 4th of July, we could hit that 70% number. And that would be incredibly helpful for all of us in the state and good for our economy if we were able to hit that number. And that's why we're really encouraging people to go and make your vaccination appointment. Help your loved ones who are struggling to get an appointment, or a neighbor who hasn't yet gotten a vaccine. I spoke with a man yesterday who the health system near him called him and said, we've got some appointments, and he had already obtained one through Meyer. And so he actually went next door and asked his neighbor and his wife went and got it. This is the kind of thing that can really help us get to that goal that I know we all share. We may not see eye to eye on every issue in this moment, but I hope and believe that we all want that normalcy, and that's how we get it. Thank you, everybody. Have a great day.
Governor Gretchen Whitmer live from Lansing at a press conference this morning discussing the latest with Michigan's response to the surge of COVID-19 cases here in the state. The governor very much doubling down on her latest stance of taking no further action with restrictions at this time and encouraging the public instead to continue to try to get vaccinated and to take extra precautions over the next 2 weeks, including including asking that schools suspend in-person learning at the high school level, as well as sports practices and competitions for 2 weeks. Ronnie, a lot happening in that press conference, but not a whole lot of clarity in how we address the current surge and at least slow it down.
Yeah, I was really surprised. I thought that given her stance and some of the measures she has taken prior to this, that she was going to pause school and indoor dining once again, but she didn't. She's simply recommending people not eat indoors, and also just recommending high schools, and they make the decision on their own to go remote for the next 2 weeks. What instead, pushing the vaccines. The one thing I was hoping someone would address is there is going to be a lag time, because if I get a vaccine today, it's still not, I'm not fully protected yet. There is that lag time for the vaccine to take effect. But really at this point in time, the governor is simply saying, we know what works. We've heard it a million times over the past year. Wash your hands, be socially distanced, and wear your mask.
Yeah, that's really where they're going with this now, is saying to take those extra precautions, and then with availability still being in place for half capacity at restaurants and partial capacity in retailers, that you do your part to keep your distance by staying outside, by ordering takeout and by ordering drive-through and all that, instead of sitting in the restaurants, which some people are going to follow and some people aren't if they haven't already. And it still is surprising to me that the governor has had this change of heart. I mean, one thing that was really staggering to me in that press conference was her saying that these restrictions aren't working with this, and then having a situation there too where she had mentioned that the precautions being suggested are not being complied with on a mass enough level, and that's affecting it, and then later saying that this isn't a compliance issue. So the consistency from the governor is where I'm concerned here, because this is the peak of what we've been dealing with as far as COVID-19. Hospital systems are getting very concerned about the situation, and it seems like there's a change of heart at the state level and how to react to it without a whole lot of justification as to why that change of heart may have happened.
So one of the issues, of course, she's hoping to get addressed in D.C. is a surge. When we have a surge in cases like this, like we're seeing here in the state of Michigan, is trying to come up with some type of program, national program, where they can shift vaccines from one state to another state or to another region that is experiencing the surge that we're seeing right now. Of course, several things contributing to the surge, one being the variant that is out there, people traveling as well. We know so many people right now, Tyler, are on spring break.
Yeah, spring break's still going to have a big factor in this current surge, and that's part of the reason I think why these schools are being encouraged to suspend in-person learning at the high school level until further notice, why they're being encouraged to suspend sports practices and games until further notice, is because they are concerned about this recent surge and the need to slow things down, particularly in the schools. And while a lot of these kids, because they're not 16 and older in these schools, particularly high schools, can't get vaccinated, that's the way to slow things down, is to take out those social activities and distance them away from the school facilities.
Of course, testing is going to be a big issue going forward as well. And so they are doing some of these pop-up testing sites throughout the area, and even at airports as well, and they're asking people to get tested if you've been exposed to anyone with the virus. I will say I know a lot of people right now, just like back in the fall time when it seemed to come through this area, the virus, a lot of people were getting COVID-19. We're seeing it again, and they're saying it's that younger group, plus students as well, which in that regard, a lot of these kids, you can't get the vaccine unless you are at least 16.
Yeah, and that's the biggest problem here, is a lot of these kids in the schools where there's been a large amount of this current spread as of late in the COVID-19 surge, they are under the age of 16. They can't get the vaccine, or they're not yet there to get the vaccine if they are eligible, and they're the one, and this is the situation where most of the spread is happening. So to pull kids out of the high schools for 2 weeks, of course, a recommendation, not a requirement from the state government to suspend high school sports practices and games. Again, a recommendation, not a requirement, in this case from the state government, could help severely impact that surge and maybe slow it down a little bit from the biggest problem area, which is that younger population.
Well, we do know a lot of teachers have been able to get vaccinated throughout this process, so that number is high, but really it's looking at some of the students that are unable to get vaccinated, that COVID-19 is spreading throughout the state, and they are tracking 991 outbreaks across Michigan right now, and a lot of those are connected to schools or youth sports.
Yeah, youth in school sports is the biggest problem area, and that's why I think the governor and Dr. Khaldun as well. Dr. Khaldun is the one who said in her part of the press conference today that they recommend the high school suspends in-person sports practices and competitions. She says that from the perspective of the Department of Health and Human Services, the governor in agreement with that, of course. And so while we have that, but what was also surprising, and we spoke about this off air during the press conference, is the fact that it wasn't addressed that kids under the age of 16 can't get the vaccine, and that's another big reason why these suspensions of high school learning, recommended suspensions of in-person learning and sports activities, are being recommended by the Department of Health and Human Services.
So with that, we'll take a quick break here on the Megacast, and then when we come back, we'll get the show rolling. Up with us next, we're going to be talking with Elrick, former reporter, current podcaster, and city council candidate. We'll talk to him about that and so much more next on the Megacast.
Finally, I just got my COVID-19 vaccine.
I registered with my local health department and they called me.
I got mine at the pharmacy and my neighbor got hers from the hospital.
I'm not a techie person, so I called the COVID hotline and they helped me schedule an appointment.
Get vaccinated with the first vaccine you can. Protect us all.
Learn more at michigan.gov/COVID vaccine. COVID-19 has caused many families to fall behind on finances and on groceries, but you're not alone. You shouldn't have to worry about putting food on the table. My Bridges offers access to quality food and income assistance to help families across the state get the food support they need. It's easy to apply and easy to start shopping. Apply for services at michigan.gov/MIBridges. A message from the Michigan Department of Health and Human Services.
I want to get back to seeing my grandbabies every Sunday and smothering them with big hugs and kisses.
I want to get back to football games with my boys.
I want to get back to feeling and touching, connecting with the people around me.
I want to get back to family dinners and my grandma's mac and cheese.
I want to get back to real grocery shopping, taking my time, walking down every aisle, smelling the tomatoes and melons, having a free sample or two, or 3.
COVID-19 has changed how we live and how we feel. But now, there are vaccines. And they are the first step that let us get back to feeling optimistic about the days ahead of us. It's okay to have questions.
Is it safe?
Should I get it?
Should I wait?
Now, get the facts. Learn more at getvaccineanswers.org so you can make an informed decision when vaccines are available to you. Brought to you by the Ad Council.
Great to have you with us here on the Megacast. I'm Ronnie Dahl in the studio alongside Mr. Tyler Keefe. We want to say thank you to our next guest for hanging in there with us, running a little bit behind, of course, because of the governor's presser. With that, ML Elrick with us here on the Megacast. ML, I see you sporting your shirt there.
That's right. I'm pimping the show. I'm pushing the product.
Hey, we're down with that. We're down with that. So, ML, we used to work together years ago back at Fox 2. Since then, of course, so many of us know you from the Free Press, your Kwame investigation throughout the years, but also you're running for city council. Are you crazy?
Maybe just crazy enough that it might work. I've been a reporter for 30 years, and I'm at a point in my life where I want to focus more and more on my neighborhood and on the city of Detroit. You know, I started out as a City Hall reporter, expanded to covering Wayne County, then the state of Michigan. But as I get older and more involved in my neighborhood, I care more and more about local things more than larger things. And so as a city councilman, I'd be able to continue being a problem solver, continuing to try and make sure that we're getting what we deserve out of our government, that we're putting public service instead of self-service. And so to me, in a lot of ways, I know it seems kind of crazy, but it feels like a natural transition to me. And I hope that voters give me a chance to see what I can do.
So with that, there are some, there's a little bit of competition in the race up against you as well. Sure. But do you think your name and all of the work that you've done through the years is going to help give you the additional votes that you may need to get this seat?
Yeah, and when we talk about the work that I do, certainly the work I did at the Free Press, at Channel 4 and at Channel 2, people are aware of that. But I think that some of the work that I'm known for in my neighborhood is more like coaching baseball, softball, and soccer at Baldock Park and Messmer Park, which are right here in the district. Being on the school commission at our local Catholic school. Being involved in neighborhood cleanups and serving as the East Outer Drive street representative, being a member of the East English Village Neighborhood Association Board, being a part of the Friends of the Alger Theater restoration effort, and just basically being a guy who, when something needs to be done in the neighborhood, gets done in the neighborhood, cutting neighbors' lawn when there's an empty house in the neighborhood, cutting the grass on Outer Drive, which is supposed to be done by government, but when they don't do a good job of keeping up with it, we can either complain about it, which is fair enough, or we can do something about it because we don't want to see that grass getting to be a foot high. So I'm pretty well known by my neighbors as a guy who they can turn to make things better. And then throughout the district, different parts of the district where, you know, it is a large piece of land where I'm not seen as often, they probably know me from my work as a reporter.
I will say the thing that I love about seeing former journalists run for elected positions is because one of your platforms is centered around transparency. And here in the state of Michigan, we don't do so well when it comes to transparency in the government. How do you think you can actually change it from the inside?
Well, for one thing, I'll be a strong voice on city council saying, why are we denying people access to public records? Why are we sending people who request public records exorbitant bills to produce those public records?
Yeah, that's crazy. People don't realize that, right?
Process? Yeah, I mean, there's, and I've filed these same Freedom of Information requests too, and people should know, this is not a privilege for the media. Any citizen, in fact, you don't even have to be a citizen. You could probably be from Mars, and you still have a right to the records and the documents that are created by our public officials. And there's a few exceptions, but they're very narrow exceptions. But to me, a lot of what happens in government is dictated by the charter, which is the Constitution of the city of Detroit. It's dictated by rules, but even more is dictated by tone and tenor and personality, quite frankly. And right now we have a city hall where everything's sort of come and get it. If I get in there, my attitude will be, come and get it. Here we go. We want you to have it. We want the public to know what's going on. We want people to know how decisions were reached. We want people to know how their government is working because it's supposed to be working for them. And if it's not, we need to get that ship turned around and headed in the right direction.
So, ML, for the people that live in the suburbs, why should they care about who is sitting on the council in the city of Detroit?
But two reasons that I think won't require much Google research. When the schools went in the toilet, the state of Michigan, which means everybody in Michigan, came up with hundreds of millions of dollars to get the schools back on its feet. The city of Detroit, when I went into bankruptcy, got hundreds of millions of dollars from the people of Michigan to help get the city back on its feet. Quite simply, Detroit is the hub of this wheel that we call Michigan. And when the hub needs the bearings replaced or is just completely messed up, we all have to pay for it. Now, the other issue is Detroit is also the reason why a lot of people come to the state of Michigan. And we want to have our most important city functioning as well as it possibly can. We want it to be a place where we can go to shop, to dine, to recreate, to even just walk around and take in the beautiful architecture, the cool restaurants and bars, and now some wonderful parks, as well as sporting events and concerts, and know that the city is safe, it's clean, it's well run, and that it's a place that we can brag to our friends about. Detroit is a place to be proud of. And while a lot of people in the suburbs may be like, oh, there goes Detroit again, I guarantee you, when they leave Michigan and they're out there in California and Florida and New York, they're like, I'm from Detroit. It's the best, baddest city in the country. How do you like that? Well, that's the way we should feel. We should all feel that way. And really, we all have an opportunity to be involved in Detroit's comeback and its resurrection. All you have to do is want to be a part of it. And I'm inviting everybody to be a part of this campaign. If you want to volunteer, if you want to contribute, if you want to introduce us to people who care about the city of Detroit, ml4detroit.com. Come see me. I got something for you to do, because Detroit's future is Michigan's future.
You're listening to 89.3 WBLD Orchard Lake, 88.1 WBFH Bloomfield Hills. With that, ML, I have to ask, I don't know if you were listening in on the governor's press conference, but are you as confused as I am right now on why she's not putting restrictions in place like she was doing just a few months ago?
So I did not catch all of the press conference. I find all of this very confusing, but I also think it's not because there's some sort of cabal out there or some sort of diabolical plot to leave Michiganders scratching our heads. It's because everybody who has any experience dealing with a pandemic that's anything like this has been dead for decades, or they were 1 year old at the time and now they're 103. You know, there is great debate over what's the best way to approach this. Different states have tried different things. Some of it has worked, some of it has not worked. Some of it has only worked because of the climate in those states. You know, I don't envy the governor trying to make sense of all this. And I certainly don't envy my friends who own bars and restaurants and hotels and businesses who have basically spent their entire lives trying to figure out how to get as many people as possible to come through their doors, now saying, I need to limit how many people come through my doors, but I still need to find a way to stay open. You know, I don't envy my friends and neighbors who work in places that have been restricted or shut down because of all of this. And frankly, I'm an athlete. I play a lot of sports, and hockey is one of the sports where we've been yo-yoed for months, where we can play, okay, we can't play, you can practice, but you can't have games. Okay, you can play games, but you have to wear masks on the ice now. I respect what the governor's trying to do. I follow the rules when she puts them out there. I encourage all of us to follow the rules. I read something that was done by a Nobel laureate who looked at all of the literature that was written coming out of plagues going all the way back to the 1400s. And government responds differently. It's always a mess. And this guy said the one thing that every one of these plagues has taught him is that people who are the most afraid live the longest. Now, I'm not suggesting we should live in fear, but I am suggesting we should be very cautious. Wear your mask, social distance, wash your hands, and get vaccinated as soon as you possibly can. Because if you want to fill Tiger Stadium or Comerica Park, we all have to be vaccinated. I'm sorry. You might not like it, but you want to get back to normal? Get your ass someplace where they can put a needle in your arm, and let's go, people. I want to see the Spartans in person this fall, please.
Tell me about it.
Why, you want to see them lose in person?
Oh, come on, Ron.
Well, they're playing Michigan, so we should have one win.
That's true. Very true.
We're talking with ML Elrick. He is a former reporter. But you're also now, your podcast is still on, right?
You bet. Soul of Detroit. We just had a great episode that's posted where we spoke to legendary Channel 4 anchorman Mort Krim about some pretty interesting stuff. His conversations about faith are pretty interesting for a guy who was a preacher's son. And he also talks a little bit about his affair with Jessica Savage and everything in between. So you got everything from God to bod, and he's just a really interesting guy, very sharp. He has a book out. He talks about how he got involved with the White Stripes. I mean, there's some really interesting stuff in there.
It is fascinating. So ML Elrick, the name of the podcast is ML Soul of Detroit. And I would imagine people can download it wherever they get their podcast.
We insist upon it. Yes, you can find it on our website too, which is mlsoulofdetroit.com. We have a lot of notes on the show. We have past episodes. We tell people how they can buy merchandise and things like that, and how they can contact us, because one of my favorite parts of the show, and Ronnie, I know you'll appreciate this as a journalist, is we have a lot of feedback that we read on the show. We play voicemails. We basically turn a portion of the program over to the audience and say, here's what you want to talk about. Tell us what's on your mind. And if they have a question for us, we respond to it in real time, or we try and get answers and bring it back on a future show. So it's very interactive.
So with that, I have to ask you, what were your thoughts when Kwame was released? Did you ever think you would see it happen so soon?
I thought there was a very good chance that Donald Trump would pardon or grant clemency to the mayor. In fact, my surprise was I thought it was going to happen much sooner. I thought releasing Mr. Kilpatrick would have been a genius move for Donald Trump early in 2020, because it would have allowed the mayor to get free, to become an active advocate and influencer for Donald Trump and his reelection campaign. And if anybody saw the letter that Kilpatrick wrote to Donald Trump, it was effusive in its praise. He basically kissed Donald Trump's butt and said, you and I are pretty much the same guy. We were wrongly accused. We've been attacked by the media. We are victims, and we're good guys who are trying to help people. And I think that Mr. Kilpatrick could have been a very powerful advocate for President Trump and probably got him thousands of votes that he would not have already otherwise gotten in Michigan. So I was surprised it took Trump so long to grant Mr. Kilpatrick's release. But I think everybody who watched Donald Trump over the last 4 years knows that trying to predict what that guy's going to do, you're better off trying to predict the Michigan weather. Just as crazy. Michigan weather has better hair, but otherwise, there's no way. You have no idea what he's going to do.
That is so true. I was thinking the exact same thing you were. Yeah. I was like, let him out, and if you're going to, do it to help you with the election. So I was really surprised, and now Bobby Ferguson wants out, but I think that ship has sailed for him.
Well, you could argue that Ferguson's already done twice as much time as Kilpatrick, because his sentence was significantly shorter than Mayor Kilpatrick's, mainly because as a public official, when the sentencing guidelines go in, public officials, they get a multiplier that really socks it to them for betraying the public trust. But the fact that they've done the same amount of time means that Bobby's already done, if you think about it, twice as much time as Kilpatrick. And I think you could make an argument that if you're going to let Kilpatrick free, you should let Bobby Ferguson free. If you feel that Mr. Kilpatrick did not receive a fair trial, then you have to feel that Mr. Ferguson did not receive a fair trial. So I think the way this went down really showed that this was political, and that some powerful people received a very special favor from the President of the United States.
But with that, too, Kwame's still got to pay back millions of dollars. Where's he going to get the money?
There is still a restitution bill owed. My sense is nobody is going to work too hard to collect that, but that remains to be seen. He was granted clemency, which is different from a pardon. Mm-hmm. His sins were not forgiven. Just the price that he was supposed to pay for them was discounted. heavily.
Right. So we're talking with ML Elrick. He is a former reporter, but also a podcaster for the ML Soul of Detroit, who now wants to be an elected leader. On top of all of that, though, just another minute or two here with you, ML, before we say goodbye, though. Your thoughts on journalism today? Do you think nonprofit or independent journalism is going to be the new thing to get real hard-hitting investigative journalists back into the game?
Well, I think journalism, as much as people like to think of it as being some sort of charity, has always been a for-profit business. News is not free. It costs a lot of money to produce that news. And so if you do not subscribe to the News, the Free Press, the Oakland Press, the Macomb Daily, the Royal Oak Tribune, shame on you, because reporters need that revenue to continue to do the work that everybody wants so badly. And while nonprofits and philanthropic efforts have helped fund reporting positions, before I got in this race, I was working at the Detroit Free Press, and I worked with many colleagues who were funded by grants or who were there as part of some sort of nonprofit program. These are outstanding journalists, very good at what they do, but they're also limited where they can only work on a certain subject matter because that's where the grant money came from. You also have a situation there where very talented people who you want to keep in town, when the grant runs up, they've got to go somewhere. And I don't think you're going to get the kind of high quality reporters and photographers and editors who know their communities the way you really need to know them to do the kind of job that we deserve as members of the public, without having people where you can offer them not just a position for a year or two, but a place to become a part of the fabric of the community that they cover. I've lived in my house in Detroit for 22 years. I moved here because I grew up on the east side. I love Detroit, but I knew I wanted to cover Detroit politics and Detroit government, and I knew that one of the ways that would make me the best I could possibly be in doing that was to be a part of the community, to be invested in the community, and to have to live by the decisions that public officials make. When the trash doesn't get picked up on time, I'm not answering the phone from someone complaining to me about that. I know it because I'm staring at it through my front window. So nonprofits, they're wonderful. It's a great way to kind of get us to the next business model. But the only solution to having a robust, vigorous, aggressive, and public service-oriented media is for us to pay for it. That's the way it's always worked. That's the way it has to work. And you don't go to the gas station and say, boy, I sure would like to drive across town. Can you just put some gas in my car? You know what happens when they do it? Somebody comes running after you with a bat or a gun. You pay for stuff you need, folks. You need news. Pay for it. Come on. It's not that tricky.
Right. And we should point out that your wife does, is she still with the Freep?
Oh, yeah. Pay my wife's salary, please. I should have disclaimed that. But yes, my wife is a reporter for the Detroit Free Press. And a lot of the work that she does goes behind the paywall that you have to subscribe to read it. And, you know, it's something like 99 cents a month. I think that's pretty much worth it. I subscribe to the News and the Free Press, even though I could get them for free, because this is part of supporting the institutions that keep America great.
And we need, especially print, we need print to survive. People don't understand sometimes the impact that print has on our communities, so continue to support that. Hey, ML, before we say goodbye, your conversation with Mort Krim, other than him, who was some of your other most interesting guests that you've had on your podcast?
Sure. Well, so we've had Daniel Ferguson, who's Bobby Ferguson's cousin. We've had one of the prosecutors in the Kilpatrick case. We've had Mayor Duggan on a couple times, Secretary of State Jocelyn Benson, Detroit City Clerk Janice Winfrey. We've had Ben Blackwell from Third Man Records, who played in a band called the Dirt Bomb and basically runs the vinyl record and retail merchandising operation for his uncle Jack White of the White Stripes. We've had, well, this week we're going to have a guy on who's involved, we're trying to finalize it, but who's involved in writing the Star Wars franchise and is a graphic novelist and just has done some amazing stuff. So we have some public policy stuff. We go behind the scenes in journalism. We've had Rob Walchek on, Devin Skillion, the Night Cam, Tim Pamplin.
Did he wear a bag over his head?
He would not go on camera with us. We do a Facebook Live broadcast, but he wants to maintain the mystique. We had Scott Lewis on talking about not only some of his best stories as a problem solver at Fox 2, but what he's been doing since he became a private investigator. So we have a lot of really good guests on there, and the show's about an hour long. We also have some music in there. There's some alleged comedy in there, and there's a lot of spirited conversation and debate with my co-host Mark Fellhauer and with Sean Windsor, who's a sports columnist at the Detroit Free Press. So it goes pretty quickly, and we have a lot of fun with it. We hope listeners do too. But we also try and make it worth your while to get you some behind the scenes stories and to talk a little bit about how journalism works. I mean, Ronnie, you would appreciate some of the episodes. You wouldn't have learned much because you already knew this stuff, but we talk about how we do surveillances, why it is sometimes we have to jump out of the bushes to grab people. And so we tell those stories and some of the behind the scenes stories too.
ML Elrick with us here on the Megacast. I will say good luck on your the election, but I will say we'll miss you as a reporter because we need people like you to continue working in journalism. But best of luck on the new venture in your life.
Well, thanks. They say priests are always priests, and I think reporters are always reporters. So whether I'm an elected official or working for a news organization, when there's news, I'm always going to want to be the first to tell everybody.
ML Elrick, please go to his podcast, support some of the work that he is doing as well. ML Soul of Detroit. ML, thanks again for being with us.
Thanks, Ronnie. And if people want to know more about the campaign, it's ml4detroit.com.
We're going to take a quick break here on the Megacast. Still a lot to get to in the remainder of this hour. This is the Megacast.
Over a decade ago, the journey to a COVID vaccine began. Building upon research on other coronaviruses, scientists continued with months of research and development, 3 phases of clinical trials with tens of thousands of diverse volunteers, then peer review and authorization to deliver a safe and effective vaccine that will protect all of us. Discover the facts for yourself at michigan.gov/COVID vaccine. Wearing a mask is more than protection. It's a bridge to better days. The path back to celebrations with family. Nights out on the town with friends. Game days with your favorite sports teams. And the thrill of live concerts. But until we can all get the COVID-19 vaccine and build community immunity, which will take time, we all need to continue to stay careful. Because Michigan's recovery is depending on you, and so are your family, friends, and neighbors. So even after you're vaccinated, wear a mask, avoid large gatherings, and social distance. One day in the near future, we will all be able to put this pandemic behind us. But until then, spread hope, not COVID. Learn more at michigan.gov/coronavirus. A message from the Michigan Department of Health and Human Services.
In times like these, we have to believe in each other.
And we believe that you'll do the right thing.
When it comes to stopping the spread of COVID.
Follow the 3 W's.
Wear a mask.
Wash your hands. Watch your distance.
And when it's your turn to get the vaccine, take your shot.
It all comes down to the golden rule.
Treat others the way you want to be treated.
We're so close, Michigan.
We can do this together.
Quitting smoking can improve your health, but it also protects your loved ones from secondhand smoke. Did you know there's no risk-free level of exposure to secondhand smoke? Smoke from cigarettes, e-cigs, and hookah can travel through ventilation systems and harm those around you. So clear the air and stop secondhand smoke. Call the Michigan Tobacco Quit Line at 1-800-784-8669. A message from the Michigan Department of Health and Human Services.
Great to have you with us here on the Megacast. I'm Ronnie Dahl here in the studios alongside Mr. Tyler Keefe. As always, you can catch us on Civic Center TV, Birmingham Area Municipal Access, Channel 15 on Comcast, 99 on AT&T. Listen to us on the radio, if you're out driving around. 89.3 Lakes FM, 88.1 FM, The Biff. We want to say thank you to our next guest for sticking around. Of course, we're a little behind schedule today due to the governor's press conference, but excited to have Linda Petty with us here on the Megacast. She's the Sales and Marketing Director for STS Marketing Agency. Linda, thank you again for hanging out with us. We appreciate it.
No problem.
So tell us about STS Marketing Agency.
Well, as an agency, I can put together different events. I help small businesses to create their dream or market their business the best way, plan, strategy, things of that nature. I have been doing that for a while. In addition to that, I like to do specific events, such as the one that I'm doing right now. So that's pretty much it.
Before we jump into some of the events coming up, so important for businesses right now to reach out to experts such as yourself in the middle of the pandemic.
Absolutely. And you know what? I have found that startups are probably who I've been speaking with over the years. And when they start up, there's a lot of things that you need to know to start up a business, not money, budget, strategy, family life, how do you plan on surviving, those type of things. So I kind of bring up the common sense part of it first, and then we go into what your strategies are. So
with that, bring us up to speed. People are starting to get out again. Events are starting to happen. Tell us about some of the things coming up.
Well, I'll just take you back with of course, you know, the virus and how it's been over the last year or so. And I just took a passion of mine, which is dancing. And I wanted, actually, what I found out is after I stopped being able to do it, it really was a slump in how I felt. I didn't realize one day a week would make that big a difference, but it did. I went out, enjoy yourself, socialize, and more importantly, the exercise was very important. And over the last few months, you know, I thought to myself, I said, well, why don't I try to put something together myself, have a little twist to it, meaning that maybe some old school, we're talking, you know, disco, in addition to the things that we do already, like the hustles and things of that nature. Now, it's not all just fun. This type of dancing really releases chemicals like dopamine and endorphins out in your brain, which causes this really happy feeling. And it is scientific, and you're thinking, wow, this does make a big difference. You know, like the runner's high, you get out and you run, and you're wondering why it doesn't matter what the weather is, they'll get out there because they want that feeling. And that is what
I've never reached that point as a runner, I will say. Nope.
It is a feeling, I tell you. And then it is such a calming effect on you. And that's not the only exercises like that, but definitely that one is. And then with the dancing that was so much for me. So I just took a passion and decided to create an event. And with that event, I decided, well, where would I like to do this? I'm not going to go buy a building or, you know, get a liquor license or anything of that nature. So I decided, as entrepreneurs do, they decide, how can I strategize this? What can I do to make this happen without those components? And that's when I thought about the Skyline Club. I mean, I had been there before, and for businesses, you know, going for networking and things of that nature, but they have a beautiful place in there where it was just a great fit. When I went in there, entrepreneurs know just right off, yeah, this is it, you know. So you put together a plan of action. They had not ever done anything like this before, but you put a good plan of action together that makes sense, of good value for them and for people who will be attending. Just makes sense. So I decided to move forward with it. And so I put together, it's pretty much a new business, but under STS Marketing, but it's Funn Time Society, and it's a membership actually, and it just works so much better. So that's how this was all created.
Well, and if anything, throughout the past year, it is about changing how we think and trying new things, because we've all had to change how we've been living. So I know that this is going to be what, like once a week, and then how is it actually working?
How the package is as of such. First of all, what's the value? The value has to make sense for people who go out in ballroom and things of that nature, or people who don't. But it has to have some value to it. So we did a monthly membership, meaning that we picked out 4 Tuesdays a month. Once it's COVID ready, we'll be ready. 4 Tuesdays a month, you're able to come there. Food's included, your drinks are included, it's free parking, no cover charge, just come in, long as you pay for the membership. The membership makes sense because you would, as you would do something if you went out per week, how much you would spend to go out. So that's where the value comes in. So actually it's a monthly membership. It's 4 Tuesdays a month, and you come and you really enjoy yourself from 6 to 11.
And so I'm sorry, when do you anticipate these events starting?
Well, we're going to, based on the Skyline Club, we're trying to wait. Well, they're waiting till they're COVID ready, and that's probably going to be July or August, possibly even September. But they know it's going to happen. We just have to be ready when it is. So that's the reason why I'm building a membership now. And people that know about going out and having a great time, I think they'll like the idea. I've had people already telling me, oh yeah, I definitely want to do this. Let's get going here. And so we do have to wait till it's COVID ready. And everyone's getting their shots and things of that nature. And so by that time, I think we'll have a better idea. But we're looking for at least September.
We're talking with Linda Petty. She's the Sales and Marketing Director for STS Marketing Agency. Right now, they are selling memberships for the Stop in the Name of Fun. It really is a good concept. And like you said, $100 a month, it seems like a lot, but really, when we spend so much more than that when we're going out. So it really is, not that bad when you're adding in all of the add-ons with that. Linda, how can people find out more information about this?
Well, I just put together a Facebook page as well. So we're up and live, and everything is right on the Facebook page with Funn Time Society. So it tells you everything that I'm saying. You can pay on the site as well. That's probably one of the best ways to do it at this time. We'll be doing it in different areas in terms of getting it out in newspapers and things of that nature. But Facebook now is our branding, what we choose to brand it with at this particular time. And we'll have it out like that. But in addition to that, we're going through different companies as well. So talking with different companies, letting their employees know this is available for them. You'd be surprised how many companies want to do things for their employees, or maybe companies that want to do things for their patients, or they want to do things for their clients. So, it is about sales anyway. So that's primarily the way that we're doing it this time. We're going to do a whole branding promotion.
Well, Linda, we so appreciate your time, and it sounds like it's going to be a good time.
It's going to be a great time. Seriously. Hopefully you can get involved there.
So, again, do you want me to go ahead and throw out the phone number, 248-231-8400? Is that still the number
Absolutely.
for people to reach you?
That's exactly, you can. And it's Funn Time Society @gmail.com. 2 N's in fun. So.
Oh, great. Well, thank you so much. We appreciate your time. And again, our apologies for the late start today.
Not a problem. Thank you for having me.
Happy weekend to you.
You too. Bye.
We're going to take a quick break here on the Megacast, and when we come back, the Friday fun continues, Tyler. We're going to be joined by Ben Sharkey. He is a musician. I was on YouTube listening to some of his music. Extremely talented.
Yes.
So we'll be talking to him next on the Megacast.
I want to get back to seeing my grandbabies every Sunday and smothering them with big hugs and kisses.
I want to get back to football games with my boys
I want to get back to feeling and touching, connecting with the people around me.
I want to get back to family dinners and my grandma's mac and cheese.
I want to get back to real grocery shopping, taking my time, walking down every aisle, smelling the tomatoes and melons, having a free sample or two, or 3.
COVID-19 has changed how we live and how we feel. But now, there are vaccines. And they are the first step that let us get back to feeling optimistic about the days ahead of us. It's okay to have questions.
Is it safe?
Should I get it?
Should I wait?
Now, get the facts. Learn more at getvaccineanswers.org so you can make an informed decision when vaccines are available to you. Brought to you by the Ad Council.
Over a decade ago, the journey to a COVID vaccine began. Building upon research on other coronaviruses, scientists continued with months of research and development, 3 phases of clinical trials with tens of thousands of diverse volunteers, then peer review and authorization to deliver a safe and effective vaccine that will protect all of us. Discover the facts for yourself at michigan.gov/COVID vaccine.
Quitting smoking can improve your health, but it also protects your loved ones from secondhand smoke. Did you know there's no risk-free level of exposure to secondhand smoke? Smoke from cigarettes, e-cigs, and hookah can travel through ventilation systems and harm those around you. So clear the air and stop secondhand smoke. Call the Michigan Tobacco Quit Line at 1-800-784-8669. A message from the Michigan Department of Health and Human Services.
Wearing a mask is more than protection. It's a bridge to better days. The path back to celebrations with family. Nights out on the town with friends. Game days with your favorite sports teams. And the thrill of live concerts. But until we can all get the COVID-19 vaccine and build community immunity, which will take time, we all need to continue to stay careful. Because Michigan's recovery is depending on you, and so are your family, friends, and neighbors. So even after you're vaccinated, wear a mask, avoid large gatherings, and social distance. One day in the near future, we will all be able to put this pandemic behind us. But until then, spread hope, not COVID. Learn more at michigan.gov/coronavirus. A message from the Michigan Department of Health and Human Services.
Great to have you with us here on the Megacast. I'm Ronnie Dahl in the studio alongside Mr. Tyler Keefe on this fun Friday.
Yes, fun Friday.
We made it to Friday. Hey, so this has been a crazy time for all of us, but I can't imagine what it's like to be a musician throughout all of that. And so to talk a little bit more, let's bring in Ben Sharkey. Great to have you with us here on the Megacast.
It's great to be here.
What's this past?
Oh, sorry. I was just saying that last story was really interesting. But I'm glad to be here.
Well, you can always go back and catch some of our other interviews. I think you were on a little bit later. ML Elrick was on a little bit earlier, but if you go into the on-demand section of Civic Center TV, you can listen to some of the other interviews. With that, though, Ben, how are you surviving right now? Still making music?
Yeah, still making music. I think a lot of musicians went to the recording studio during this time, and there's some music to be made in that realm. But I think a lot of musicians are inherently pretty creative, and they can think of ways to survive in times like this. So it is definitely a struggle. I definitely find myself, having to do a lot more preparation for shows since we're not performing as often. So I'm even actually nervous for next week.
It's been a while, huh?
It's been a while. So, but I'm so excited to be performing, in front of a live audience and, an in-person show again at the Imagine Theater next week. It's such a cool concept, and I'm so excited for. It's a different thing too, because it's at the theater and they have these like plush chairs, and it's the recliners, and it's all safe and everything. So it's so exciting.
It really is an interesting concept. So you're more or less jazz, right? Like I think of you, I think of like Harry Connick Jr., Michael Bublé. Would you say that's your style of music?
Yeah, you know what, I guess, yeah, I've definitely, that is my root, is jazz. Harry Connick Jr. was a huge influence of mine. I get compared to him a lot. But I also, so I started off performing a lot of jazz for, venues around town and, different parties and stuff. But I also started getting booked for events, like charity events that wanted their attendees to dance. So I started blending in more like the popular swing stuff, and then I even, there's some modern contemporary artists that have some swing stuff in their repertoire, like Justin Timberlake. He released that 2020 Experience, which has like a little bit of that swing band kind of stuff, and then I'm even dipping into some Motown now, finally. And so it's a full gamut of things. I think it's just a lot of music that I really love, and that I think a lot of people really love, and it's cross-generational, I would have to say. So I think that's something that would describe me more than just Justin or Harry Connick Jr. or Michael Bublé.
So how did you actually get started? Like, you were like a YouTube sensation, right?
Yeah. So I went to college at the College for Creative Studies. Actually went to, I got a BFA in Fine Arts. And during that time, I still wanted to sing. And the art was actually my backup plan, believe it or not, from singing. I always wanted to be a singer. But at that time, I was just, YouTube was coming up, and I saw some people posting videos of themselves singing, and I thought, I could do that too. So it started off really small. I got excited for having like 100 views, and then I kept on posting, and then it blew up, and I was featured on the main page, and it blew up to a couple 100,000 views, and then it just kind of snowballed from there, and then finally, up to like 5 million views.
Wow.
Soon after that, yeah.
So have you been like on social media and YouTube throughout the pandemic?
Yeah, we've done a couple live stream shows, which had some success, which was awesome. But nothing beats a live audience. You just to be an entertainer. I would envision people through the camera. Kind of similar to the whole YouTube experience. Just putting it on for the camera and imagining people on the other side. But I'm so excited to be performing, for a live audience next week, and having things open up. I'm getting my shot at 1 o'clock today, my second shot. So I'll be all set, and I won't be calling in sick next week.
We're talking with Ben Sharkey. He's a local musician here. With that, Ben, so again, it's live at Imagine. It's pretty creative that they've come up with this concept. Fill us in again. How is it going to work? And are tickets still available?
Tickets are still available, although it's, they're going. So I would definitely recommend going to, I think you can Google Imagine Royal Oak, and it'll take you to the website, or you can go to bensharkey.com and go through to the tour page, and it's on there, and you can find tickets. It's at half capacity. It's in the theater itself, where movies are normally shown, and they have, I don't know if you've ever been there, but they have these plush leather chairs that are so comfortable. So I definitely have to make sure that I keep it upbeat because I don't want anyone sleeping in my show. But it's half capacity. I think that the groups, if there's any big groups, they might be split up a little bit because they want to make sure that it's all safe. Masks are required. There's the groupings are like 7 feet, I think, between rows, and then 9 feet between seats. So you're never within the 6 feet distance, which I think would make people feel really safe. I would really feel safe with that. So
I think it's been so creative at Imagine what they come up with. I believe in the middle of the pandemic for a while, they were even opening up to students, basically making like a learning pod because they had all this space. And so they've been creative throughout this, but boy, do we miss live entertainment. So this is great to see that they've come up with this.
Yeah, I know. I'm ecstatic about it.
So again, tickets.
And then I'm also performing with Nicole New, which I don't know if you know who she is, but she's another songstress that's similar vein as me. She, does the jazz, but she also, I think she messes around with some Motown as well and some pop stuff. So it's a nice collection of songs that we're performing. I'm not sure if she does any originals, but I definitely have originals that I'll be doing as well. So it's going to be a nice collection of songs in the evening and a great band behind us too.
Are you dancing?
I might be dancing up there for sure.
Because you have some moves. I watched the Pistons halftime show that you put on a few years ago.
Oh yeah, got a little bit of moves there. I definitely like to have the music move through me.
Well, Ben, along with the event, again, tickets start at $20. You're performing, it's going to be Saturday, April the 17th. And again, it's at the Imagine Theater over in Royal Oak. So it's imagine-entertainment.com if you want to get tickets, but get them quickly because they are going to be selling out. And with that, where can people find out more information about your music as well?
BenSharkey.com, and anywhere that you download music, you can find me. Just Google or search for Ben Sharkey. I do have to say there is a show tonight at Imagine as well. This is a whole string of concerts with a lot of local musicians, and Laith Al-Sadi is performing tonight. You might have heard of him from The Voice. He was on The Voice. And I would like to go to that. I'm getting my shot today, so I'm a little nervous. I've heard like there is some fatigue that goes with the second shot, so I'm maybe hesitant. But if I'm feeling good, I might go to it tonight.
Well, that's great. So Ben, it's been great, so great having you with us.
It's been a pleasure.
Keep making music, and good luck with the performance as well.
Thank you so much. I appreciate it. Have a great day.
You too. Happy Friday to you.
Yes.
We're gonna take a quick break here on the Megacast. When we come back, we are going to be talking to the CEO and the Director of Youth Enrichment with the Detroit PAL League. That's next here on the Megacast.
Finally, I just got my COVID-19 vaccine.
I registered with my local health department and they called me.
I got mine at the pharmacy, and my neighbor got hers from the hospital.
I'm not a techie person, so I called the COVID hotline, and they helped me schedule an appointment.
Get vaccinated with the first vaccine you can. Protect us all.
Learn more at michigan.gov/COVID vaccine. COVID-19 has caused many families to fall behind on finances and on groceries. But you're not alone. You shouldn't have to worry about putting food on the table. My Bridges offers access to quality food and income assistance to help families across the state get the food support they need. It's easy to apply and easy to start shopping. Apply for services at michigan.gov/MIBridges. A message from the Michigan Department of Health and Human Services.
I want to get back to seeing my grandbabies every Sunday and smothering them with big hugs and kisses.
I want to get back to football games with my boys.
I want to get back to feeling and touching, connecting with the people around me.
I want to get back to family dinners and my grandma's mac and cheese.
I want to get back to real grocery shopping. Taking my time, walking down every aisle, smelling the tomatoes and melons, having a free sample or two, or 3.
COVID-19 has changed how we live and how we feel. But now, there are vaccines. And they are the first step that let us get back to feeling optimistic about the days ahead of us. It's okay to have questions.
Is it safe?
Should I get it?
Should I wait?
Now, get the facts. Learn more at getvaccineanswers.org so you can make an informed decision when vaccines are available to you. Brought to you by the Ad Council.
Great to have you with us on this Friday. Just about 15 minutes left in the show. I can't wait for live music and live baseball.
Yes. Baseball season is back. Of course, the Tigers have started their season with limited capacity at Comerica Park. The season over in the USPBL at Jimmy John's Field will be starting very soon, and other leagues around our state for youth and recreational sports will also begin playing baseball, or have already.
So with us now, I'm sure they're just as excited to try to get back to normal as well. Let's bring in Robert Jamerson and Maria Franklin. They're with the Detroit Police Athletic League. Great having you both with us.
Yes, we're truly excited. How are you?
We're good. Robert, why don't we go ahead and start with you? How are things going there at the corner? So it's still called the corner, right?
Yes, it's the Corner Ballpark presented by Adient, and many still know it as historical Tiger Stadium. Right, and so we are thrilled. I mean, we're getting as close to normal as we can. We're starting to see the kids come out. We've already been doing some programming, thanks to Maria over here, and we're just excited right now, just because I think we can see the light, at the end of the tunnel now.
I will say, Robert, you guys have done an amazing job. For anyone who hasn't been by there, the ballpark looks incredible, and I know that part of it was planned to be used for a lot of special events. Are you able to book anything right now?
Yeah, so everything is safety first, right? But I couldn't think of a safer place than being outside with over 190,000 square feet of field space, including concourse space. So we just opened it up to where we're going to be hosting more graduations this year, just because of being able to use that space. And in our indoor space, we have really started booking some events. The corporate events are a little slower. We believe they'll pick up in September sometime. But some of the more intimate events, family gatherings are already occurring, and just people are enjoying the facility like we'd hoped it would occur.
So, Maria, of course, the focus of the Detroit Police Athletic League is all about the kids. Are you going to be able to have any summer camps this year?
Yes, actually, we are planning our summer camp for the week of July 13th through the second week of August. We're excited about that. Last summer, it was amazing. We have parents that were signed up already for this summer. We're gonna connect the kids to biodegradable baseballs, doing science and STEM. We're gonna be able to take them abroad, traveling to places like Africa virtually. And we have lots of fun activities in store for our kids during the summer camp.
Maria Franklin is the Director of Youth Enrichment for the Detroit Police Athletic League. And Maria, how do you come up with some of these programs?
We come up with them together as a team, sit around and we say, what is it that we can offer in a safe way, that we can do in a socially distanced way, but that we know the kids are going to enjoy. We think about the needs in the community. We just finished a girls empowerment series, and we looked at what can we do to empower our girls as part of our Girls Changing the Game initiative, which is one of our strategic focuses right now, to uplift, encourage, build confidence in girls, and help them to be the leaders that we know they are.
Go girls!
I know. I'm laughing. You asked that question. I'm like, how do you come up with these things? But they really, what she does that I love is she really she puts her heart into it. She thinks about her kids, her family. She thinks about everybody else's kids and their families as well, and she puts the same love and care no matter who she's trying to serve. And so we're truly thankful for Maria and the work that she does for us, for sure.
So Maria, I would imagine that this summer is going to be extremely busy, especially after all the remote learning. Parents are going to be, get outside.
Oh yeah, absolutely. The parents are excited and thrilled anytime they can get their kids into a safe, fun space, and that's exactly what Detroit POW offers. Our kids love the opportunity to be able to be outside and play on our field and run freely. There's really no better place for them, and we're going to do lots of that, from baseball to softball with our girls and boys, soccer, and in addition to all of our youth enrichment programming.
What a cool place to get to play ball. Hey, Robert, if I can ask you, because one thing the governor did ask today, she wants to do a 2-week pause on youth sports due to the surge right now. When you see the numbers continuing to go up and up and up here in the state of Michigan, the COVID numbers, what thoughts are going through your mind to try to make sure all of the players and the participants are safe there?
Yeah, the first thing we think about is safety. You're talking about a news flash before her address. A lot of times we're privy to some of the things that they're considering, because who better to watch the numbers than people that are going to be responsible for helping to ensure that there's a safe environment for the kids and the families. So we already have some contingency plans in place. We made the adjustment to ensure that a lot of the teams and the youth that are participating in our programs are getting tested. And now this delay, how we put that in place is really going to be thinking in terms of safety first, but also things that are practical. Sometimes being a grassroots organization like ours, we have to anticipate some of the things that the governor and others may not think about logistically that can be challenging. Right? And so that's why when we think about every change that occurs, anything that we do, sometimes there is a time component, sometimes there is a capacity component, and many times there's a dollar component to being able to make sometimes simple adjustments to be able to ensure that the kids have fun places to play, but places they can develop as well.
So with that, too, how is it looking? How are you going to do the testing? Because I worry about some of these kids, like how many tests can you get in a month and your nose isn't sore?
Yeah, it's amazing the sacrifices that people are doing to enjoy the things that they enjoy doing, right? You know, we would say the same thing about people that are traveling right now, right? Or people that are going back to their work environments, you know, but we've been watching the major league teams do this testing and be able to get through successful tournaments and league play. And similar to us, we're setting up and partnering with people that have the capability to be doing some of those testings. Imagine we have to, you know, remove some of the barriers that some of our participants have with transportation and things like that in order to make sure that they can get to the testing site before those times. So we're thinking of all ways, you know, a lot of ways that can help remove some of those barriers and make it more practical, but also so we can get our kids out and enjoying the play in a safe way.
Yeah, but I think so many kids right now after this year, they need to get outside and play and be kids again. It's been such a stressful year for them. You know, with the remote learning, I have a hard time. You know, I was taking a Photoshop class, and you realize you almost need 2 computers, right? One to watch the lesson and one to actually, you know, try to follow along. So these kids have really had a tough year. And with that, Robert, tell us, what are some of when do the programs start, the camps start?
Yeah, so we have some programs right now that you can register for. So we have our Tiny Tigers. Those are our, you know, 6 to 8-year-olds who will be out on the field soon, starting in June 12th. where they'll go out and they'll learn how to become the next professional baseball player, right? And then we always try to tie in some type of youth enrichment program just based off of Maria's vision for adding an educational component to that. We also have just regular summer baseball, and that's for our older kids. And then we have continued youth enrichment program that goes throughout.
Yeah, so we have our app design and entrepreneurship program that's starting actually this month.
Wow, yeah.
That's on the 27th of this month. And our kids are going to do that in person, socially distanced, and spread out. And we piloted before and it went really well. So we're excited about that. Yep. But that's a partnership with Apple and MSU. So we have our great partners working with Sarah Greta and Amanya Dobb over at MSU has been really, really great. So we're excited to bring that program to Cal Youth, and its registration is open for that right now.
So we're talking with Maria Franklin, Director of Youth Enrichment, and Robert Jamerson, the CEO for the Detroit Police Athletic League. And Maria, how can people sign up for some of these programs?
So they just go to DetroitPal.org. They can go and register for all of the programs that are available.
Robert, we do know that funding has been so tough for so many organizations over the past year. How is your budget looking right now?
The budget is interesting to say the least, right? And so we definitely need people that understand the importance of having a mentor speak into their lives, understand the importance of grassroots organizations that help to address some of the systemic challenges that we face, including police relations, which is a pivotal and integral part of what we do here with the Detroit Police Department. We need your support. Every day, every dollar counts. So if you go to DetroitPal.org and go to donate today, you'll have an opportunity to be able to give. We have a concept around membership, right? Everybody understands the importance of being a member. What that means is having access to the information so you can get it out to your family members, but also it talks about this accountability of being a member and being the change that you want to see, right? So for $30 annually, it's about 5 cups of coffee. You can be the change you want to see to be able to enhance the programs and ensure that the next kid that's coming up has an opportunity to find their greatness.
Yeah, and we really are all in this together. How important is it right now to have those police relationships with the community?
It is vital. When you start thinking about at higher levels, a lot of times it's hard for them to logistically think about the plan to be able to truly address police relations in a sustainable way. There's a community policing part that is something that PAL's been not just piloting, but been doing successfully for over 50 years. Right now, we're working on a program that reaches beyond some of the city limits of Detroit through our football and cheer program. In partnership with the Michigan Youth Football League, we now reach into Southfield, Pontiac, Warren, Ecorse, including the 6 or 7 teams that are in Detroit. So now we get to use the Detroit Police Department as a benchmark for how we can train, orientate, and include officers across other cities to go beyond the unconscious bias or some of the orientations that they may have and really enrich and ingrain themselves in the community, right? So we're truly excited about being able to now share some of those benchmarking best practices and do it in a sustainable way to really be the change we want to see with police relations and community engagement.
I love that you're expanding it beyond Detroit, because even though, we're not separated by 8 Mile, we are all in this together.
Absolutely, absolutely. What many people don't know is that because PAL is generational, just think 50 years being around, you have people that no matter where they move, they still want to go back and play for the coach that they played for before, or be a part of the organization that they participated with before, or just be a part of PAL. So we reach up into Flint, we go into other areas in the state, and we do it in a way where we don't a lot of times have to advertise because people come to us as being a trusted source.
Well, that's so great. Robert Jamerson and Maria Franklin with the Detroit Police Athletic League. We thank both of you for your time today.
Absolutely. Thank you as well.
And again, if you want to get involved, you want your kids to get involved, it is such a great program. But sign up. Do it now, because I have a feeling so many of these summer camps are going to book up quickly this year, Tyler.
Yeah, a lot of people are looking for fun things to engage their children in over the summer, especially athletics and socializing safely as well. And camps like what are being provided by the Detroit Police Athletic League and other organizations in our community are going to start to fill up pretty quickly, because they are available, but also because they're available at a partial capacity that's different than past years, so that these institutions can continue on with the same fun and the same educational aspects that they've previously had employed, but do so safely with the pandemic still going on.
So again, if you want more information, go to DetroitPal.org. Also, if you can, help support the program, because they do a lot of great work. And I don't know if you've had a chance to be by the field down there since they've redone it. It is amazing.
Yeah, I haven't been there for an experience down at that park, but I have passed by it several times, and it does look fantastic. It's in great condition. It's a great environment for these kids, and the historical aspect of it is it's going to be, of course, awe-inspiring for the kids and everybody that goes down to the old corner at Michigan and Trumbull, where Tiger Stadium once stood.
That's pretty much going to wrap it up for the Friday edition of the Megacast. What a week it's been.
Yes, it's been a very exciting week. A lot of interesting interviews and some interesting perspectives as well this morning from the governor. All that, of course, available civiccentertv.com/megacast.
And of course, if you want to catch the interviews, individual interviews, just do so by clicking the on-demand section. Everyone, have a great weekend. Stay safe and stay healthy. This has been the Oakland County Megacast.